Hi, my name is Amber Lemmons, and I'm a student at Duke University studying public policy. I've been working this summer under the guidance of Professor Michael Frakes at the Duke University School of Law and Professor Melissa Wasserman at the University of Texas Austin School of Law. This summer, I've been working on literature reviews for their upcoming project and paper on the legal remedies to geographic sources of racial health disparities. This paper comes in response to the large variation in healthcare utilization between different regions in the United States. This variation was initially found in the 1970s by the Dartmouth Institute and has since been researched and analyzed by many experts who have concluded that most of the variation is caused by physician discretion rather than patient preferences, which was initially hypothesized. Physician discretion also manifests into the racial health disparities in health outcomes and life expectancies that exist in the United States. There's a lot of overlap between racial health disparities and geographic variation, some of which comes from variation in intensities of care in areas with a high population of minority communities, as well as on a smaller scale within regions where segregation differs which hospital communities go to and the varying intensities of care at each hospital. Some of the legal options I explored include civil rights law and constitutional law. Civil rights law primarily refers to Title VI, which deals with anti-discrimination in federally funded organizations. Title VI has some potential, though it has been seriously weakened by judicial decisions that revoked its private right of action and disparate impact claims. However, some experts have found promise in Title VI because it could be leveraged against racial health disparities when looking within a district, which gives some hope for potentially reducing the effect of physician discretion and regional variation. Constitutional amendments, such as the 13th and 14th Amendment, have been considered by experts, though on a more theoretical level. There is some precedence in the 13th Amendment that would justify government intervention for anti-discrimination efforts, but this pathway is less promising in terms of being recreated in the healthcare sector. Tort law and medical malpractice litigation within it does offer some potential for reducing racial or regional variation that causes racial health disparities. One issue with tort law, though, is that the current legally accepted standard of care includes all the variation of intensities that leads to the racial disparities, health disparities that exist right now. One potential solution to this drawback would be the creation of clinical practice guidelines, which would standardize care across regions and also remove the effect of implicit bias in physician decision-making. By creating these guidelines, physician variation between regional regions would reduce, and so tort law offers the greatest potential for reducing the effects of regional disparities on racial health outcomes. Going forward, it's not 100% clear whether tort law would be successful in this legal pathway, so more research is definitely needed, and support should be given to any policy or set of guidelines that would work in achieving the aim of reducing racial health disparities. Feel free to scan the QR code at the bottom to access the long list of articles that explore this subject further. Thank you.